Hi, I'm Paula Jameson, and I'm coming to you from the studios of Public Media Network in Kalamazoo, Michigan. Today we're going to have a very interesting conversation about a way of practicing medicine that comes from ancient India called Ayurveda. And Kalamazoo is fortunate to have a new program in the community that teaches people about this form of healthcare and self-care. And I'm pleased to have the Dean of Instruction, Bill Courson, at this program coming to us today to talk about Ayurveda and approaches of Ayurveda to mental health. So Bill, welcome.
Thank you so much, Paula. I am so happy to be here with you today. Thank you for having me.
Well, and thank you for coming. And I'm hoping you'll start off by giving us a little bit of a thumbnail sketch about Ayurveda and maybe talk a little bit about the program as well.
Well, certainly, just to share some information on the program with you, the Bodhananda Vedic Institute, or BVI School of Ayurveda, opened its doors to its first class in April of this year, April of 2015. It is a 1-year, 12-month program of instruction in the theory and applications of Ayurveda, and it's intended to educate Ayurvedic health consultants or Ayurvedic practitioners who will be able to bring the knowledge and the useful knowledge and practice of Ayurveda to their communities and helping their communities to achieve optimal or near optimal levels of health, or to restore an optimal level of health where it's lacking. It prepares individuals to function as practitioners serving the wider community, but also it enables individuals to take a larger measure of responsibility for their own health care, for that of their families and friends.
Well, I know that some of our audience will be familiar with Ayurveda from the works of Deepak Chopra, for example.
Oh, yes, among others, yes.
Who has been a great popularizer.
Yes.
And one of the impressions that I think people would get from reading him is that this is a very holistic approach.
It is indeed holistic,
Could you say a little bit more about how it's holistic?
Yes, well, Ayurveda comes down to us from ancient most India. I like to call it yoga's sister science because it and yoga grew up together in ancient India. It is holistic in that it treats the whole person. Unlike most Western practices, it does not draw sharp lines of separation between the body, the mind, and the spirit that animates both. Okay? It is a holistic system of medicine in that it treats the totality of the person. We don't approach an individual as a disease which has a name attached to it. This isn't fibromyalgia that I'm treating. This is Mary Smith that I'm treating, or Joe Brown that I'm treating. So we treat the whole individual. Thus it is that if we're treating an individual for a particular problem, their treatment, the details of their treatment might bear very little resemblance to our treatment of that same pathology in another individual. Ayurveda is a highly, highly individualized system of medicine which puts to the sword the notion that one size fits all.
And which implies to me a couple of things. One, that you would not see the specialties in Ayurveda in the way that you would in the West, where someone specializes on a particular body system or specializes in something like psychology or mental health versus, say, physical disabilities.
You do not see it in this part of the world. In India and in the countries adjacent to India, where Ayurveda is a university discipline, like medicine or dentistry or fine arts, you do see it in India. There are 8 traditional specialties within the broad context of Ayurveda, including pediatrics and obstetrics, which were treated as a singular specialty, psychiatry, toxicology, rejuvenative medicine, surgery, ear, nose, and throat medicine. So there are specialties, but in practical terms, those are not institutionalized outside of India.
Interesting, very interesting. Well, let's say a little bit more about the idea of mental health then for Ayurveda, because you're talking about this very fundamental connection between body and mind and spirit too in Ayurveda.
Yes.
So how does the Western idea of mental health compare then with Ayurveda?
Well, in the West, we've drawn a sharp line of divergence between the mind and the body. Okay? In Ayurveda's view, it is impossible to draw a line between the two. There is no separation. There is no divergence. When Western practitioners use the term psychosomatic as an adjective, saying, well, that's psychosomatic, what generally is understood and what generally is intended to be understood is that whatever your problem is, it's all in your mind.
It's all in your head.
Well,
Right.
yes, okay, it is, but you have no idea of how large your mind is. Yes, of course it's all in your mind. Everything is all in your mind. Having said that, the word is being used incorrectly in that it implies a one-way street. In fact, the psychosomatic response is a two-way thoroughfare. Biological events and processes can evoke psychological consequences. Psychological consequences can evoke psychological events and processes can evoke biological consequences. If you think about the last time that you were in an emotionally charged situation, perhaps you were feeling anxious or you were feeling angry, think about what that did to your stomach, to your digestion. The effects probably were palpable and immediate, and so there's absolutely no question that the two are so closely related that it's impossible to make a meaningful distinction.
And in the West, we've come rather recently to exploring those connections. I mean, if you think about the work of someone like Herbert Benson years ago on stressors and what he calls the relaxation response.
Yes.
So we've started to kind of tease that out a little bit in our own rather different way.
The work of Herbert Benson and the elaboration of the newly born science that calls itself PNI, psychoneuroimmunology, yes.
Candace Pert,
There's one organism
right.
that embraces both the processes of mentation as well as the physiology.
But Ayurveda got there a long time ago, sort of starting from the whole, it sounds like.
Yes.
Right,
Yeah.
right. Well,
You cannot draw a line.
let's talk a little bit about what would happen if someone comes to an Ayurvedic practitioner, someone such as yourself, and they're complaining of some level of maybe psychological unease, shall we say. What would you be looking for as this person came in to see you?
An Ayurvedic evaluation is based upon 3 diagnostic indices or principles. We call them, I'm not going to get into the Sanskrit.
Thanks.
Okay. Observation, interrogation, and palpation.
Okay.
We watch the individual. We observe their bodily conformation, their bodily movements, their tone of voice, the way they compose themselves, their posture. We listen to their verbiage. We listen to the kinds of words they use. We listen to their rapidity of speech. We listen to their tone. We take an exhaustive individual and familial medical history, including a social history of the individual. We want to hear this individual's story. And very often, because we take the time to do this, one gets the impression that this is often the first time that they've spoken to an Ayurvedic practitioner, is the first opportunity they have had to really tell their story. We take the time to listen.
And that in itself, I would think, would have enormous kind of healing benefit.
You know, it really does.
Yeah.
It really does. It really does. Lastly, when I say palpation, to palpate something is to feel it. We perform a conventional Ayurvedic examination of the individual, which would include an examination of their, as I said, their overall bodily conformation, their eyes, their tongue, most importantly, their pulse. You see, Ayurveda evolved at a time when mechanical ways of looking inside the body, like endoscopies, did not exist. So we had to use those portions of the body which were directly observable to give some indication of processes that are unfolding within. So observation, interrogation, and palpation.
And I'm kind of curious with pulse, obviously in the West, we have a very almost quantitative sense of measuring pulse.
It's entirely quantitative in the West, yes.
And yet I've had the impression, and maybe you can say a little more about that, that taking a pulse for Ayurveda is a little bit more than just counting beats. Could you say something about that?
It's considerably more insofar as we involve ourselves not only in an analysis of quantitative factors, but as much, actually very much more so, qualitative factors. We don't just care about pulse rate, although yes, we do care about pulse rate, but we also care about the pulse's quality, its amplitude, its character. Is it a light pulse? Is it a thready pulse? Is it a heavy pulse? Is it a hot pulse or a cold pulse? And those terms hot and cold have specific technical meanings in Ayurveda. Does the pulse have a certain height and depth to it? You know, is the pulse a profound one, or is it a more subtle one? So there are a great many issues involving the pulse that afford us, in the first place, an opportunity of determining what this individual's baseline is. What is their constitutional baseline? Where is their optimal state of balance? Which is ordinarily the balanced state that one is born into the world with, as compared to what is their present state. How far from that optimal balance have they diverged, and in what direction?
And that, to me, seems like it would be part of the art and, in a way, for an outsider, the mystery of this process, because you're seeing this person that you may never have seen before, and yet you're trying to figure out not only where they are right now that's out of balance, but where they ought to have started from. And can you say something about how Ayurveda gives you some clues to that?
Yes. Well, you're absolutely right. This is definitely where art enters into the practice of Ayurveda, or to the practice of any variety of medicine.
Absolutely, right.
Yes. I need to preface this by, got to use a little bit of Sanskrit. There's no way of getting away from it. In Ayurveda, we talk about something that we know as the doshas. It's spelled with a D like dog, doshas. And the doshas are psychobiological forces that exist within the human body. Not just the human body, but the animal body, the plant body. And briefly and put in context, there are three doshas. You can take the word dosha to mean category or classification. And the three doshas are three forces that are somewhat cognizable to Western medicine. And those forces we give names to: Kapha, Pitta, and Vata. Kapha is, in a Western context, very simply anabolism. All of the processes of the physiology that build tissue, that give structure. Pitta is catabolism. All of the processes of the body that, either on a gross level in the gastrointestinal tract, or at a tissue and cellular level, promote the digestion of nutrients and the nourishing of tissues, organs, and organ systems, and the organism in its totality.
So kind of a processing.
When we take in extremely large, complex macromolecules from our nourishment, those need to be broken down and put into a simpler form, more easily utilizable by the body and its systems. And this is what Pitta does. It burns. Burning is simply a reducing to simple elements of complex structures. So Pitta relates to all of the processes of catabolism or digestion. Lastly, we have Vata dosha. Vata relates to all of the communicative or transportative faculties of the body, whether it's the circulation of blood in the bloodstream, the movement of lymph through the lymphatic passages, the voluntary and involuntary movement of the smooth and striated muscle tissue, the inhalation and exhalation phases of respiration.
Nerve impulses?
Absolutely, the transmittal of nerve impulses along their conduits, and also the movements of thoughts, ideas, feelings, and impressions.
Which is where this brings it into a whole other level.
Indeed it does. Indeed it does. So all of these things evince the power of Vata dosha at work. Now, the doshas have a second meaning. Each of us have all three of the doshas present in our bodies, in every part of our bodies, in every cell of every tissue at all times. However, ordinarily, one or more of those doshas are proportionally present to a greater degree in some individuals than in others. Thus, we can look at a person and say, well, you're a Vata, or you're a Pitta, or you're a Kapha, which means that you exemplify both the appearance and the traits of an individual in whom that dosha or those doshas are predominant.
So to come back to the consulting room with you, then a person that came through the door having an experienced eye, you or the practitioner would be able to get a pretty good idea that this person is maybe more Vata and a little bit of Pitta, and so that would already give you a little bit of a map of what you were looking for?
In terms of their present state, that's ordinarily grossly observable. However, we need to verify that through the taking of a history, through an examination of the pulse and several other diagnostic modalities. I can't look at a person and say, constitutionally you're a Vata because you might have just lost 100 pounds. Or constitutionally you're a Kapha because you might have just gained 100 pounds. Or you know, so relying purely on observation can be very deceptive. It is just another diagnostic parameter.
Which is why it fits in with these other modalities.
Exactly. Now the three doshas, each dosha, individuals possessing a particular dosha that is predominant will ordinarily exemplify certain traits of character, certain habituations of thought, certain propensities and aversions. Thus it is that the doshas become useful in assessing what those are, and if they are in an imbalanced state, in addressing them and correcting them.
Okay. And so let's kind of take this process a little further. As you've, and I don't know if we want to even kind of invent a case study for this, but as you're working with a person and you find, you know, and you have findings, is this something then that you share with this person immediately, or do you kind of see this person over time? I mean, when I think of mental health practitioners in the West, I of course think of what remains of the old idea of the talking cure, that someone comes in and you have a series of conversations which may be supported by interventions with drugs, may be supported by interventions with actions you want this person to undertake. Is this part of what goes on with an Ayurvedic practitioner?
It is part of what goes on. In one respect, it actually exceeds what goes on. Firstly, I happen not to be a psychotherapist. There are Ayurvedic practitioners who are psychotherapists. So at the level of the talking cure, my intervention with the client is simply to be a sympathetic listener. Okay, I am not skilled in the practice of psychotherapy. And I ordinarily, routinely, in fact, very, very often do refer individuals whom I think would benefit from one or another form of psychotherapeutic processing to an appropriately qualified practitioner. And ordinarily that is a clinical psychologist or a licensed clinical social worker. I don't refer to psychiatrists very often because most are principally involved with psychopharmacotherapy.
Exactly.
And Ayurveda has its own protocols with respect to the medicinal or drug treatment of various mental, emotional, and behavioral syndromes. Yes, certainly, we practice a little what I guess you might call social psychiatry in that we're nice to the client. Okay? We listen to them.
That counts for a lot.
We're a sympathetic listener. The ancients who elaborated Ayurveda call this sattva vijaya, encouraging speech. That's all. That's all. In terms of other modalities that might come into play, clinical nutritional therapy from an Ayurvedic perspective is very important. You know, we pay close attention to what the individual is taking in from his or her environment that may be either aggravating or ameliorating their emotional state. Very often, herbal and herbal metallic medication is an important part of such people's protocols. However, a great many of the Ayurvedic substances that are used in the treatment of these types of disorders are contraindicated if the individual is on conventional psychotropins. For example, if you are taking Klonopin, clonazepam, or Wellbutrin, or Paxil, or some other commonly prescribed substance, no Ayurvedic practitioner can give you one of the Ayurvedic standard substances, remedies, insofar as the two will interact and probably potentiate one another. Now, I do get a number of individuals who are on psychotropins who, given their sometimes very deleterious side effects, want to come off of them. And in those instances, I have to work with the individual psychiatrist to gradually diminish their dosage of the one, whilst initiating a gradually increased dosage of the other. So we have to be quite careful with that. Very often, body work, massage, and other manipulative therapies and physical therapies are quite useful in dealing with problems of this type. Very often, very often, yoga is very useful in treating emotional and behavioral mental disorders, bearing in mind that there are some such disorders in which yoga is contraindicated. For example, disorders characterized by impaired reality testing or an impaired perception of ego boundaries. You know, meditation, the use of mantra. Mantra is chanting particular Sanskrit sounds. They're ordinarily of a devotional character, but their sound is more important than their content.
Because of the resonance in the body that it produces?
Yes, precisely for that reason. We might suggest that the individual avoid certain activities. An individual may be engaged in an occupation to which they're psychologically or physically unsuited, and that can very often be productive of mental, emotional, behavioral problems. We might advise the individual to undertake certain lifestyle practices to amend their daily schedule in a way that might be better suited to maintaining degree of mental
some
balance.
of that might even have to do with perhaps how much sleep they would be encouraged to get, or how much exercise, or things
yes,
like that.
yes. Ayurveda puts a very high premium on the quality of one's, well, you mentioned sleep, on the quality of one's sleep. And as a matter of fact, lack of adequate sleep will erode an individual's immunity, using the word in its Ayurvedic sense, resiliency, faster than just about anything except alcohol intoxication. Those are two things that will very quickly break down an individual's immunity. Ayurveda puts a little bit of a different meaning on the word.
Say a little
immunity.
bit more about how Ayurveda conceives of immunity then.
Well, immunity is the end product of an optimally functioning digestion. That is the ability to use one's resources, things that are taken from outside the body inside, in an optimally efficient way in building tissues. And if that process unfolds in an optimally efficient way, the end product is immunity. Now, immunity is embodied in something that has both a substantial as well as an energetic character. That's something, the glow of health, the ability to deal with changed circumstances, whether those changed circumstances involve bacterial or viral infection, or an unpleasant change in the weather, or having to work at an overly taxing job. Whatever the change is, immunity is the capacity to meet it head on.
And you mentioned the word resiliency before.
Resiliency, exactly.
Which sounds like that really does sort of capture that. I mean, there's a flexibility that's implied there.
That is
and
right.
a capacity to marshal resources when needed and then not have them at hand when not needed, in
That's
a way.
exactly right.
I mean, I think of my own tendency sometimes to over worry about things, you know.
Surely.
Try to over address problems.
Yes, yes, yes. And the tendency to do that is something that is in one way or another inherent in everyone, inherent in all three of the doshic types. I'd mentioned Kapha, Pitta, and Vata.
Right.
All three of the types have what I'll call a default negative emotional state. For example, in Kapha type individuals, you see a significant propensity toward depression, usually accompanied by a withdrawal from social interaction.
Kind of a dampening down
A
of...
dampening down, retreat within,
Yeah.
you know. In Pitta-dominant individuals, you see a propensity toward irrational anger, irritation, and irascibility, as though there were just a exposed nerve endings.
A little bit of a hair trigger there.
A little bit of a hair trigger there. And in Vata types, you see a propensity toward anxiety. So, now that's not to say that any of the types can't have any of those problems.
Right, right.
That's not to say that those problems exist in a state of balance. But when you talk about humans or you talk about any kind of biological organism, that which is balanced can more or less easily become unbalanced. Okay.
Well, and I think there's an underlying message here that it's really easy when you're looking at things that have been popularized, like the idea of the doshas, to try to make them into some sort of fixed entities, and you're this or you're that. And what you're saying is that this is a very dynamic kind of relational thing that's going on among these sets of qualities, really.
Well, yes, yes. When we talk about your constitutional baseline, it's not absolutely static. It's not preserved in a block of acrylic. The doshas do move.
And it's not deterministic in a kind of utterly concrete way either, it doesn't sound like.
No, but your optimal doshic signature is your optimal doshic signature.
And it shapes who you are.
But there's some degree of movement. And that movement, actually, there's 3 cycles, a daily cycle, or actually 2 12-hour daily cycles, a cycle over the seasons of the year, depending on whether a season is hot, cold, wet, or dry, and the cycles that extend over a lifetime, from birth until the end of life. So there is some movement there. But that's all within the context of perfectly normal, non-pathological, innocuous movement.
Right.
If the movement is both profound in degree and protracted in type, then we have the beginning of a problem.
Okay. We haven't talked about it in so many words, and maybe it's not relevant to Ayurveda, but in the West, of course, we talk more and more, it seems, about stress and stressors. Does Ayurveda sort of use that concept or use it in the same way we would do it
Oh,
in the
indeed
West?
it does, yes. Stress, to put it in other words, is a changed circumstance. Any change from a habituated pattern represents a stressor. If you change your occupation, for example, let us say that you were a psychologist or a therapist of some stripe, and you find yourself engaged in some utterly different vocation. If your pattern of living has changed, if all of your life you've worked from 9 to 5 and you suddenly find yourself working the midnight shift, if your diet changes radically, if there's some change in your family circumstances, if you've lost someone and are grieving, if you've had a relationship end, or the stressors don't all have to be bad. You might have moved to a beautiful new home, just gotten married, and have a new job, and those are all equally stressful. And if you add them up and they exceed a certain quantity, yes, they're going to have a negative impact on your health. You know.
Well, and in fact, there is, and I don't remember the name of it, but there is a scale of stressors that people refer to quite a bit, and there are some huge, enormous ones like death of a spouse or finding out you have a terminal illness, and there are other things like getting married or the birth
So
of
they
a
needn't
child.
all be they needn't all be bad, but they represent changed circumstances, and they do engender stress. Okay, and stress places a metabolic tax on the organism. The body and the mind that's part of it are going to have to do something differently, and they need a degree of resiliency in order to do that. I had mentioned earlier that which we call immunity, which deals with changed circumstances, either a new partner or a viral infection. You can go in either direction. They're both changed circumstances. The ability to deal with this immunity, this glow of health, has a name given to it in Ayurveda. We call it ojas, O-J-A-S, ojas. It's a Sanskrit word. And it is an energy, but it also has a substantial material existence. In the West, we would call this substance, this chemical or set of chemicals, the immune globulins, one in particular known as gamma globulin. But it's not just a theoretical construct. It really does exist. And one is born into the world with a certain quantity, which keeps us alive, and that quantity is supplemented or depleted via one's nutritional regimen, via one's lifestyle, and so on and so forth.
Well, and would you be able to talk about some maybe general principles that Ayurveda would promote for people to help kind of preserve that or maintain that? Are there certain dietary things that just generally would be considered more healthy than
there
others?
There are, and I would have to give it to you in a very general rubric.
That's what I want.
The reason being that the details would vary from one individual to the next.
Exactly, yes.
But certainly the very first has to be listen to your body. Listen to what your body is telling you. It talks to you constantly, 24/7. Listen to what your body is saying to you.
And we live in a culture that so encourages us not to do that. I mean, provides so many other distractions from that
Oh,
it's
oh, multitasking.
yes.
The notion that there are certain things that take precedence over one's well-being. Well, you know, if health is lost, something is lost. You know. Yes, that's absolutely true. We live in a society that actively discourages that kind of attentive listening. So I would say, number one, listen to what your body is telling you.
And that may be a new skill for some people then, too.
It
Yes.
very often is a new skill. Lesson two, principle two, eat a constitutionally appropriate diet, okay? Diet is an enormously important facet in maintaining one's mental and emotional balance. And there are foods that have direct as well as indirect impact on mentation, and this is demonstrably the case. There are many of them. It varies from one individual to the next. The necessity of adequate rest, of ensuring a high level of sleep quality is hugely important. In terms of socialization, having friends is awfully important. Having friends is awfully important. A group of individuals with whom one can share oneself in some meaningful way or ways is very important. A happy and supportive home life with one's spouse or partner or children or whatever the particular family constellation happens to be, that's enormously important. Finding and doing a work that is cordial to one's character and one's personal assets is enormously important. I do believe a great amount of the illness that I see in my own practice results from, at least in substantial part, to individuals following what is for them the wrong vocation. People not doing the work that would be optimal for them. I see that very, very often. There's a huge need for vocational guidance out there.
Yes, yes.
Cultivating certain habits of thought. You know, the way we feel is very often a choice. We can choose to embrace a thought that is of a negative character and whose embracing will evoke negative consequences. And we can follow that path to its destructive end. Or we can train ourselves to, when confronted with a negative thought or pattern of thoughts, to turn our face away, to look in another direction, to choose a happier thought, to choose an optimistic thought. I'm not talking about ignoring reality here.
Correct.
You know, it's very, you know, the expression, walking past the graveyard at midnight whilst whistling a tune. That's not what I'm talking about.
Right.
I'm talking about where there's an alternative of paths that we can go down. When we find ourselves following a path that will lead to anger or irascibility or depression or loneliness or whatever.
And this could very
have
much
you.
dovetail with, and there's a lot of information now out there about various forms of mindfulness training that,
Yes, indeed.
that have been, I mean, they've kind of been there in the West, but we've never really embraced them until maybe 30, 40 years ago, where they started coming to us kind of through the back door from Asia. But that is, I mean, I remember my grandmother telling my mother, well, you know, just cheer up, stop it, snap out of it. Well, that's probably not enough for most people. There needs to be some...
There needs to be some training, and there needs to be a practice.
Yes, yes.
Telling someone, come on, pull your socks up. What are you, a metal case? That's not going to be helpful at all.
Right.
No, you have to show the individual how to evoke this process, and mindfulness training is one possibility. Certainly yoga is high up near the top of the list. Meditation can be, depending on the individual.
Well, and I think too, a lot of activities that require a very consistent cultivation of certain habits of mind.
Yes.
You know, and I mean, and again, that's sort of a kind of mindfulness or a kind of meditation.
Yes.
But sometimes we need to be guided into these things. We can't just find it on ourselves.
Indeed, yes. Indeed, yes. And that can be the role of the Ayurvedic practitioner. While we may not, unless we happen to be psychotherapists, engage in formal psychotherapy, the sharing of encouraging words, sattva vijaya, is awfully important.
Yes.
It's awfully important.
Well, this is really very interesting. I would like to hear maybe a little bit, in the West, for example, if you're going to go into any kind of healthcare arena, one of the things you do as a student is you take what is usually called human growth and development. And it's a course or series of courses that talks about the psychosocial and physical changes that we humans go through from birth until death. And in Ayurveda, coming out of such a different tradition in India, is there a developmental kind of view as well? Are there different stages of life?
There is. It's roughly analogous. Not simply in terms of Ayurveda, but in terms of most Indian philosophy, of Vedic understandings of how a human being is supposed to grow and develop. We talk about 4 ashramas, or stations in life. Okay. We're all born into the world with desires. You know, we all want something or some things. We all need some things. Food, clothing, shelter, relationships. So we are all born into the world with desires. The having of most of those desires is quite normal and salutary. Their execution, their being reified, that which will afford us satisfaction, necessitates our having skills, the skills that we need to work to meet those basic needs. So we have a set of desires, known as kama in Sanskrit. We need the skills and methods at our disposal to bring those legitimate desires into realization.
And a gross way of even looking at that is anybody that spent time with young children and watching how, as they grow, presumably part of what they're learning is to express these desires in more and more skillful ways.
Yes, yes, that's exactly right. And this methodology for achieving satisfaction, this ability to meet our basic needs, to be self-sufficient, we call arthra in Sanskrit. The having of desires, the meeting of those desires, necessitates our ability to give and receive information, to formulate relationships, to look outside of ourselves, and to define and reify our relationships based on our meeting the expectations of others and others meeting our expectations of what quality in those relationships are.
So this is the social side of learning things.
Lastly, the 4th stage is again referred to by a Sanskrit word, moksha, spiritual liberation. In context, the capacity to grow and develop spiritually. So these are the parameters of what Vedically would be called a successful human being, a person who is, to use the Western context, mentally healthy. Now there's postulates in Western psychotherapy that hold roughly the same. The compartmentalization is somewhat different. In Western psychotherapy. We would say, well, to be called a healthy individual, you would need integral cognitive processes. You should see things as they are. For example, when I look at the table sitting in front of us, I should see a table and not a dragon.
Or a dancing bear.
Or
right.
a dancing bear.
Right.
We need to evince responses to stimulus that are both appropriate and proportionate. I mean, for example, if you tell me that the mailman didn't deliver my mail today, I don't want to go out and shoot him. That would be both inappropriate and improportionate. Our reactions to events are both appropriate and proportionate. The third standard would be a sociality, that we must be capable of maintaining relationships, of establishing and maintaining mutually satisfactory relationships. And the fourth stage would have to do with the proximity of an individual's capacity and achievement. So if I'm capable of doing something and I'm not doing it, or I'm falling far short of what my capability endows me with, there's probably a problem. So the information is differently compartmentalized, but it's roughly similar.
It's similar. And then for the practitioner, clearly knowing the expectations of where this person is in their life cycle is going to have a bearing on the expectations for trying to achieve some level of better adjustment or better.
Yes, that's exactly right.
Better
And
ease,
and the means by which that counsel is delivered also varies radically from one individual to another. A similar approach with each individual, irrespective of who they are and what they are, is not going to work. So some individuals require a simple presentation of facts and be allowed to draw their own conclusions. Others have to be somewhat led by the hand and have issues pointed out to them. And the others need a fairly strong intervention in order to promote healing.
We've been talking about mental health, and in the world that we live in the West too, there's also a lot of talk about mental illness. And because there's really there could be a whole spectrum really there between what's healthy and what isn't. But does that kind of paradigm work in Ayurveda, or is it more the focus on enhancing the healthiness?
Well, when you talk about mental health and mental illness, there certainly is no black and generally there's no black and white, night and day pictures to be seen, other than in the most stark of circumstances. One has to weigh a great many factors in determining what is mentally healthy and what is mentally ill, and realize that culture plays an enormous part in the definition of health and illness. What may be looked upon as being perfectly ordinary and prosaic and healthy behavior in one cultural context may not in another. One has to be careful about making universal assumptions on the basis of one's own individual particular thoughts, ideas, prejudices. About 175 years ago, a book was written by a New Orleans psychiatrist. In those days, they didn't call them psychiatrists. They called them alienists. And the alienist was a man named Dr. William Collins. And the book was called Mental Diseases of the American Negro. And according to the book, now this is 175 years ago, written in Louisiana, a slaveholding state. According to the author, the most common mental illness amongst American Negroes was a disease called drapetomania. Drapetomania is a disease that causes slaves to want to run away from their masters.
Gee. Yeah.
Yeah. Now, of course, in Dr. Collins's context, what would make a slave want to run away from a well-treated slave run away from their master? Well, in any case, the therapy that Dr. Collins prescribed was a sound whipping. Okay, this is what I'm talking about when I'm talking about cultural context. So, to answer your question obliquely, yes, it's the issue is always on restoring a maximum level of balance so as to enable the individual to espouse choices that are for them maximally beneficial.
And which is a little bit different from the word that used to come up, I mean, when I was working as an OT and where you talk about function, which, I mean, function to me sort of could imply a bare minimum of just being able to get up in the morning and go to work and do my job, or it could imply having a full and meaningful life, and that it's kind of too broad a term to be very useful.
Ayurveda certainly acknowledges the importance of functionality, yes, of meeting the function, but is one going to meet the meet the bare minimum in order to enable one to do that function, or is one going to approach that function with a song in one's heart and a gleam in one's eye and a smile on one's face?
Exactly.
Obviously,
Exactly.
the latter is preferable.
Well, before we wrap up, could maybe we come back to the idea of what's going on out at the BVI School of Ayurveda, and would there be any opportunities for people in the community that might be interested in exploring one of these topics? Are there courses out there that people might be able to take?
Oh, yes, indeed. As a matter of fact, I believe it may be the next course, and maybe not, but I have a feeling that it probably is the next course to be offered, will be a course in Ayurvedic psychology.
Oh, interesting.
Or to give it its full appellation, Ayurvedic psychology and mental hygiene. It is a part of the 12-course program that leads to the certification of Ayurvedic health consultants. But individuals who may have a particular interest in Ayurvedic psychology are more than welcome to contact the school, and we'd certainly be more than happy to provide them with information on that specific course.
And we will be having contact information up on the screen at the end of this program too, so for anyone who is interested, hang on and get your pencil and write down the information. Are there some of the faculty, do they offer consultations when they're here?
Yes, they do. Yes, the faculty do offer consultations, and those would need to be made on an appointment basis with the school. Yes,
That's really
exactly what
fascinating.
Always happy to see clients.
Wonderful. Well, just based on your experience, what would you advise people in the community about having a sort of mentally healthy life? Just your quick advice.
Oh, goodness, quick advice. Firstly, I would say enjoy yourself.
Yes.
You know,
Yeah.
don't just wake up and smell the roses. Definitely smell the roses. Have a really delicious, flavorful breakfast. Enjoy your food. Enjoy your family. Enjoy your partner. Maximize your pleasure. That sounds really sybaritic, but
It sounds wonderful.
I'm going to say it anyway. Maximize your pleasure in life. And realize that if you are confronted with obstacles, that those obstacles can be overcome. Be authentic with your word, you know. Lead your life honestly and openly. And don't take yourself too seriously.
Sage advice.
Well, Ayurvedic advice.
Yeah, but it is. It's very human advice too, and it's something that we, you know, maybe our mothers told us. Maybe we weren't lucky enough to have people in our lives that told us these things.
Well, you know. I would add one more. Remember your successes. You really are an accomplished human being. So.
And we're extraordinary creatures. I mean, for me personally, that's part of that too, is just to the kind of awe and wonder at the world and what we are as beings in this world is really pretty amazing too. So, well, Bill, it's been such a pleasure.
Oh, it's been a real
speaking
delight. Thank you
with
so much for having me with you today.
Look forward to meeting with you again.
Yes, indeed.
And do you have, are there other courses that you're?
Oh, yes. The program is comprised of 12 courses, as I said, and it's for individuals aspiring to either become Ayurvedic practitioners or take a larger measure of responsibility for their own and their family's health care. But the courses, a number of them are certainly open to individual attendance. We will be giving a course in Ayurvedic psychology very shortly. I believe that's followed by a course in Ayurvedic nutrition.
I was going to ask if you had a course on nutrition.
Yes, which is
that would be very interesting.
quite distinctive and quite an absorbing subject, and also very useful. I will be teaching a course later this year in Ayurvedic herbal medicine. We didn't really have an opportunity to talk about the use of herbal medicines in treating mental and emotional
and we will be able to do that at another time.
And those are all courses in which one can enroll by contacting the school.
Well, thank you so much.
My pleasure.
And I'm Paula Jameson. Again, I was here with Bill Courson from the BVI School of Ayurveda, and this is Public Media Network at Kalamazoo, Michigan. Thank you so much. Bye now.